The face of AIDS has changed during the past 3 decades. It is now impossible to tell who has the disease and who does not. Treatment has come a long way, allowing people infected with what was once a death sentence to live normal, productive lives. Even those at risk of getting the virus can now take medication called PrEP, or pre-exposure prophylaxis, to stay HIV-free. It's just the latest weapon in the growing medical arsenal against AIDS.
It's the most powerful new tool in prevention we've had in a generation of research. And what we're seeing is that if you combine treatment, so people living with the virus getting treated, and then people at risk having access to PrEP, you really can get control of HIV epidemic.
Yet AIDS claimed the lives of nearly 1 million people last year, and experts predict 100 million people will be infected with the HIV virus by 2030. The reasons? Complacency, reduced funding for AIDS research and treatment, and the difficulty of reaching those at risk for contracting the virus. And then there is stigma and flagging government interest.
When we talk to ministers of finance, they always say to me, I thought HIV was over because I don't see anybody dying.
New infections are down from nearly 3.5 million a year, but they remain stuck at just below 2 million. There are 17 million people infected with HIV who cannot be reached. Men who have sex with men, IV drug users, sex workers and their clients, and transgender people.
Those key populations and young women account for over 50% of new infections, and they are really hard to reach.
Morrison, Birx, and Byra discussed the challenges to ending AIDS at a recent panel discussion to evaluate the findings from the International AIDS Conference in July.
We are not done with AIDS, and it is much too early to declare victory, and the risks of a resurgent epidemic are real.
The National Institutes of Health has announced an international program to find ways to reduce the stigma associated with AIDS so more people can get treated. The health agency found the highest number of untreated AIDS infections among the poor and in the Black and Hispanic communities. The agency said closing these treatment gaps is critical to ending AIDS. Carol Pearson, VOA News, Washington.